Hey guys, it's Joe Johnson again from Cardinal Health, and today we're going to review some frequently asked questions during education and during the in-service. So, one of the main questions that I typically hear is, Joe, does these three items here, do they come in a package together? Like, is there a kit or something? The answer to that is no. And the reason being, if you only needed the end clean brush, or you only needed the transition connector, or you only needed the reverse funnel connector, if it's in a package, we got to rip that package open just to get access to it, which means those other two pieces we can't really use for someone else, right? So we end up throwing those away if we don't need them. We want to reduce that waste. So these are packaged individually so that if you need this, and this is more so of a daily basis need, or if you need this to connect the feeding pump to a legacy tube, or if you need this to use a standard type of syringe, standard tip syringe with the enteral feeding port on an ENFit tube, you can use those as you need them. Keep in mind, too, these two connectors, honestly, most of the connectors, the third one as well, that AMT connector that helps you connect a slip tip syringe to an ENFit port or a Lorlock syringe to an ENFit port, um, they were designed to be temporary. They weren't designed to stay around forever. However, with challenges of supply, you're going to have to use both the combination of ENFit syringes when they are healthy, as well as your standard tip and the current syringes that you guys currently use. So you're going to need this guy. Additionally, there's still product out there that's legacy, so you're going to need that as well. And you're going to need this guy to connect your feeding pump to your legacy tubes. Another question I get asked is, Joe, why do we have to inspect this on a daily basis? And, what's the purpose of having to use that brush? Well, depending on the tube that you're working with and how that tube is built, you do have some other flexibility. The main purpose, though, for the cleaning, obviously, is to reduce having to replace this tube and remove this tube if it gets damaged, if it cracks. That nutrition sits in there, it gets really, really tight. When you try to disengage this, if this cracks, depending on the type of tube, you're going to have to pull that whole tube out and then re-drop it again, which we want to try to avoid. Now, for any of the facilities using a G tube and an ENFit G tube and our ENFit G tube, the Kangaroo G tube actually has a little surprise in it. Your peg comes right out. It takes a little bit of force, but comes right out of the G tube. So if I damage this peg and I break this and crack this port and it's no longer usable, I can stick another peg in there and replace it. It gives you that flexibility. Also, keep in mind this tube here is designed to be a longer term tube versus your nasogastric feeding tubes, which are typically 30 days, give or take. So those are going to be something that if they break and if that port snaps on there, let me grab one here. Like on this Dobhoff, if we were to crack this, this is molded on. So with that being molded on, once this cracks, now I got to pull this whole tube out and then re-drop it. And again, we don't want to put the patient through that. So definitely reinforce the need to clean and to get in there and really scrub it out if there's anything in there. And a third question that I typically hear is, hey, so you're telling me that they removed the transition connector from the pump set, so it's no longer together. But I'm still seeing some of the inventory come in where it's connected. Can you explain? That one is definitely a little bit easier to explain. So we did discontinue the packaging arrangement with having these packaged together and connected. So as of last summer, they're no longer packaged together. Now they're available separately. We as a manufacturer, Cardinal Health, have ran out and depleted that inventory that had these two still packaged together. So anything that we send you, essentially from February of 2023 on, is not going to have the transition connector in the package. However, if you have a warehouse offsite for your health network or another distributor that you're maybe getting these from, they may still have some of the previously packaged together inventory. Same SKU for all the codes with the exception of one, but they still may have that, in which case you may see that. So if you do see that, hey, if you need it, great. If you don't, pull it off. If it comes without and you need it, that's why it's still available, that you guys can purchase it separately. But you can have access to it whether it's on there or not. Moving forward, and eventually, just like the legacy tubes that we've discontinued in the summer of last year, you're going to see your pump sets come in like this, and this will be the standard. So moving forward, it'll change to where only this is the standard coming in, and only that is going to be available. The last question that I typically hear is definitely regarding irrigation and whether or not that's happening on a manual basis or utilizing the e-pump. Now, obviously, the e-pump can be set up to have a feed and flush bag or a spike and flush bag so that you can flush water on a programmed schedule or flush on demand, depending on what you need. That is a huge benefit for multiple reasons. Obviously, number one, nursing time, saving the time that you have to go into that room to do a manual flush. Number two, saving the supplies that you guys have to utilize going into a room to do that flush, aka syringes, gloves, if it's an isolation room, gown, you kind of get the picture, right? Number three, it's more accurate than having to rely on you guys, and that's no knock to you. It's just there's a lot that you guys have to accomplish on a daily basis with all the patients that you see. To take one thing off of your plate that is extremely important, that hydration being sometimes more crucial than the nutrition itself, um, to be able to program that and kind of set it and forget it is definitely worth the time and worth the investment to do so. So it is something that is definitely from an Aspen guidelines. There are Q4 30 mils as far as what we should be delivering that patient. And again, that's depending on whether that patient's supposed to be getting nutrition slash liquid altogether, especially when they first enter the facility. But once they can, making sure that we hit that and being able to program that into the e-pump and kind of automate that, um, again, is a more efficient way of doing that. So obviously you still want to flush before and after, a medication, things of that nature. But as far as administering that flush on a manual basis, moving towards that feed flush is definitely the way that needs to be. Additionally, when it comes to these ENFit ports, similar to doing that daily inspection and looking inside of that channel essentially there to see if you need to do any type of cleaning, flushing helps. Flushing helps quite a bit. It helps not only keep the lines patent when it comes to the tube itself to avoid clogs, but it also helps those connections and kind of cleaning those connections out and keeping them, as clean as they can be. So it's definitely something that people bring up, and it's something that we can discuss at a later point because not all facilities utilize that. But definitely looking forward to that conversation when necessary. So this has been Joe again with frequently asked questions about ENFit. Take care.